Hi, Dr. Chaitanya. Welcome to our second part. 10 years from now, what do you think will be the situation of doctors?
10 years, Pradeep, is too far. I am telling you, in 3 years, I will not have a job. What is required for AI to take over healthcare in a big extent already exists. Tesla taxi has been being available for the last 8-9 years because they are confident that it can move. That confidence will be much more required in healthcare. What are we taught? We are taught to follow an algorithm. AI will think of common, uncommon, very common, very, very rare, extremely rare, everything because it does not differentiate.
He died because of a mistake done by a robot. Now, what do you speak about that?
Robotic surgery is an equipment the surgeon has to use to operate. Robot is not operating by itself. Not like there won't be a doctor or a nurse, they will be required, but the majority of workforce being in the form of doctors will come down. What professions can be lost? As a medical profession, I would not want AI to come in and take over my job.
Hi friends, welcome back to another episode of Power Up with Pradeep. Today we have Dr. Chaitanya Challa on our show. He is on the show for the second time. We have seen a lot of comments coming on AI replacing doctors, etc. And a lot of comments I couldn't answer honestly. And hence we have planned to shoot second episode with Dr. Chaitanya Challa. He has spoken at length in detail of what he knows and what he thinks about how AI will impact healthcare. So let's welcome Dr. Chaitanya Challa on the show. Hi, Dr. Chaitanya. Welcome to our second part, second episode.
So thanks, Pradeep, for having me back again. I know it's nice to be here. I think last video had a lot of comments from a lot of people,
Absolutely.
doctors, non-doctors, and some comments are always against you. I think that we have accepted.
Right.
Yeah, but we are not here to please everybody.
Correct.
We are here to give information that we feel is right.
Right.
Might suit somebody, might not suit somebody, but what is right is right.
Absolutely. Makes sense. Yeah.
And this is again AI and healthcare is just my opinion on AI, and my opinion is based on lot of reading, lot of text, and as a medical profession, I would not want AI to come in and take over my job.
Right.
But then looks like it is going to come and take over most of our jobs.
Right.
In the very near future, I am saying 3 to 5 years.
Right.
We are not looking at a hiatus of 10 years. Taxis are already driving itself, Robotaxi by Tesla.
Right.
Waymo by Google.
Yeah.
I'm sure what is required for AI to take over healthcare in a big extent already exists. I think it is being fine-tuned so that mistakes and errors don't happen.
Right.
Because mistakes and error on human life can cost human life dearly.
Right.
That cannot be allowed. An accident, okay, is manageable. Not a life cannot be lost. So I think that fine tuning is what is happening now, and it's a matter of few years, maybe 3 years to 5 years before it completely takes over.
Right.
And completely means not like there won't be a doctor or a nurse, they will be required, but the majority of workforce being in the form of doctors will come down.
Right. Right. So, in fact, the agenda of this episode, as you rightly started, right, is in last episode you said we spoke multiple aspects in the last episode. One of the aspects basically went viral and lot of traction came in. To be honest, traction on this particular clip came in. The short where you spoke about which jobs will be lost and which jobs will be there in the future with AI coming in, right? There's this news which came in from Dubai. One of the doctors who said, I have 20 years of experience and built this capability of reading X-ray, and AI did that in fractions. So I'm gonna go for a MacD franchisee, right? Something like this came in news. And 2 days after this, I don't know what happened. Suddenly there's a spike on our episode and people were starting on to hopping, and I get random comments from people randomly. I'm like, this has been like 2-3 months we already did, and why is this taking traction now? Then the context is that doctor saying that in Dubai, people searching on YouTube and everyone's landing back on our page. So that sort of triggered, and I was trying to catch up with you, saying,
Yes.
sir, a couple of comments I'm not able to answer. How do I answer it, right? Trying to catch up with you. You were super busy. I was trying to catch up with Arjun, your PA, and he's like, Anna, I'll speak to sir and I'll tell you. I'm like, I took some time. I said, yeah, I think this is something that we should do second episode for sure with doctor. So that is the reason which brings me here.
Like that doctor from Dubai that you
Yeah.
are saying. See, he is one person's experience over 20 years. It took him 20 years to learn certain aspects which are very difficult for some, maybe for a person like me who's not a radiologist. We can read X-rays, read CTs, read MRIs.
Right.
But my quality of reading an MRI will not be more than a radiologist whose main job is to read MRI.
Right.
So now we are talking one person's 20-year experience of reading an MRI.
Right.
Like that, how many radiologists are available in the world?
Yeah.
Millions. All of them have 20 years, if not some have 1 year, some have 20 years, some have 30 years, some have 40-year experience.
Yeah.
All of that collectively, AI knows.
Yep.
So AI knows, in other words, AI is something that is coming out now or just come out.
Right.
But it has information of millions of doctors like this doctor in question.
Yeah.
His is one person's experience of 20 years.
Correct.
AI will have every person's data.
True.
So it's not a new thing.
Yeah.
It is, though it is a new thing, its experience is more than all individual doctors. Rather, it's as good as every doctor reading an MRI.
Yeah.
So in other words, if I give you an MRI to read, it is one person's experience that is giving a data.
Correct.
If you give the same MRI to you and me, it is two people reading the same thing.
Yeah.
But AI reading an MRI is like every doctor possible, every scan possible that is fed into the AI system
Right.
is being read.
Yeah.
So the amount of information that AI already has is far above 1 or 2, forget it. It has as much as every MRI fed into the system, it has that data.
Right.
So it is extrapolating what it has learned and putting it into that MRI that you're asking it to read.
Right.
So AI's experience, though AI is a new system, it is a sum of all the films that have been read.
Right.
So it is far superior.
Get that.
So it is far superior. Yes, it is a new thing.
Yeah.
But everything will have its little incubation time.
Got it.
So it will definitely have data which you and me will miss.
So one of the things that Sundar Pichai in recent Google I/O spoke about, right? In Bangalore, they've been trying or piloting with two of the hospitals, Narayana and I don't know one other. I don't remember the one other name, where they are working on a AI reading a human eye.
Yeah.
And it speaks about, or it probably not just tells about the retina and retinopathy, etc.
So
right?
what?
Just to complete, right? Retinopathy, and it's went to the level of detecting heart attack extra, right? So one other article that I was reading, this is on one side, Google, piloting, etc. On the other side, there are AI biases also. Now, I'm kind of little worried. How does this, governance, etc., also has to come in? So, wanted to understand your view on this.
So simple. When you learn to ride a cycle or start riding a motorcycle,
Right.
you will first ride with somebody holding, your father or your mother,
Correct.
your brother, uncle,
Correct.
holding your cycle.
Yeah.
Day one, can you ride fast?
No.
You can't ride.
No.
So slowly, the hand will come off. You will be riding a cycle with those two additional two wheels.
Correct,
So
yeah.
you don't fall.
Right.
Then after you ride it for another month, they'll remove one side, tell you that side ledu, be careful.
Yeah, correct.
Another 1 month, everything will come off and your father's hand will come back so that he doesn't want you to fall.
Right.
Few months later, there'll be no hands. You'll be riding a cycle, fast braking, sliding, everything.
Get your point.
AI is in the process right now of having those additional two wheels.
Understood.
So it will take time
Right.
for it to become completely independent.
Right.
Is it independent right now? In healthcare, no.
Okay.
Is the information enough to make it independent? Yes.
Okay.
Can a car drive itself today without a steering wheel? Yes. Tesla Robotaxi does not have a steering wheel. You can sit in it, take your phone. I want to go to Pradeep's house, put it in, it will take me to your house.
Get that.
The calculation required for a car to drive itself is something like 200,000 calculations per millisecond, something like that. I'm not exact.
Sure.
The calculations required to read a medical algorithm
Yeah.
is not even 25% of that. So the technology is available.
Get that.
AI might it be okay to have an accident.
Yeah.
Life might not be lost.
Right.
But in healthcare, you cannot afford a mistake. That is where it is in that cycle with that stage, because they need to make sure everything is perfect.
Right.
What Sundar Pichai is talking about, what you were telling me, is there are two aspects.
Okay.
I think in India only, South India, they are doing a study. I'm not sure. I think one of those hospitals is what you were saying.
Right.
They have fed retinal scans.
Right.
What is retinal scan? You take a scan and the doctor reads it.
Right.
How many ophthalmologists do you know? I might know 10.
Yeah.
I'm sure you won't know 10.
Correct.
I'm sure the team behind here won't know even 1 or 2.
Correct.
So you tell them to take a retinal scan, they'll take a retinal scan.
Yeah.
The ophthalmologist, there are very good doctors, there are not so good doctors, there are less than average doctors.
That's universal across.
That is universal across the world.
Right.
So that retinal scan is used to identify what? Many problems in the retina, one being retinopathy.
Right.
Which occurs mainly in diabetics, because uncontrolled diabetes, unknown diabetes is very high.
Yeah.
So you go with vision problem, retinal scan shows retinopathy, grade 1, 2, 3, blah, blah, and so on.
Right.
Diabetics, when retina is involved, diabetics will also have blood flow problems in the heart.
Yeah.
So AI has done a correlation saying that people who are having retinal problems because of retinopathy, they are able to pick up earlier. AI is able to pick up changes in the blood flow of the heart earlier.
Okay.
So if you go to an ophthalmologist anywhere in the world, his main knowledge is the eye.
Right.
Not the heart, not your lung, not your kidney.
Correct.
You go to a cardiologist, though he has a basic, decent plus,
Right.
above average knowledge of the our kidney, liver, brain,
Right.
his main focus is heart.
You
go to a neurologist, he won't be as interested in your kidney, lung, heart as much as interested in your brain and spine.
Get that. Yeah.
Do you think AI will differentiate that? AI will not differentiate whether you're a neurologist putting in data or a nephrologist.
Right.
All the data in the world for it is available in a millisecond.
Get that.
Or a micro of a microsecond. So it is already having the information. It knows. It has seen the ECG. It has done your retinal scan. It immediately has picked up that retinal changes are there, ECG changes are there, but your risk of cardiac problem is mild or moderate or severe is given.
Get that. Yeah.
So that way it is far superior.
Right.
One. Now imagine this. I'm sure you have some family that lives in villages.
Yeah.
I'm sure they call you to say, "Arey, this is the health problem.
Right.
City lo evarni chupiyali."
Correct. Yes.
Why are they calling you? Because of two things. City probably has better doctors, probably.
Yes.
And facility of getting checked in that village is not there.
Right.
With AI, it's the same retinal scan there or here.
Correct.
If the retinal scan can be done there and put on AI, AI will tell you what the problem is, no?
Yeah.
Why does the patient have to come to Hyderabad city?
Correct. Yeah.
Why should he come to a eye center in the city?
In fact, one of the cases that I read online, there is this case where mother and kid, they went to multiple doctors to check the kid. kid is continuously coughing or there was some health issue, and every doctor saw him and said, there's no issue, he's all good, right? But then they come back and this issue continues to be there. Probably a couple of medications and still this doesn't go off, right? And when this parent went back to ChatGPT and gave the input, my son has this problem, and basis the inputs it gave, it said that this could be a rare of the rarest of the rarest cases, and you will have to get these tests done to check. She got that done and it came out positive. Now 5 doctors of them, 5 or 6, I don't remember the exact number, but then doctors couldn't tell the exact issue, and this ChatGPT basis it, the trend, it said these check tests and the tests are positive. So when the report was taken to the doctor said, yes, this guy has an issue. It is one of the rarest. Now this definitely proves that there are cases where AI definitely is helpful, where doctor couldn't catch.
Absolutely. See, Pradeep, again, on the same thing, you're absolutely agree. See, for a doctor, we are generally taught that most uncommon presentations of common diseases
Right.
is much more common than common presentations of uncommon disease. So, for example, if you're having fever, cough, weight loss, sweating, night chills, losing weight, sputum is coming out, it is tuberculosis.
Okay.
Number 1, 2, 3.
Yeah.
I will not think of some crazy rare diagnosis first. That's what the 5 people are doing.
Okay.
Idea would be to give you some basics, try to identify the basics. Most importantly, if that is the case, go ahead, identify tuberculosis, start you on tuberculosis.
Right.
Identified X-ray, SCT, pneumonia showing, start you on pneumonia medicine. Bacterial, viral, fungal, secondary to that. I will not think of rare presentations.
Yeah.
Or common presentations of very rare disease. They're rare.
Yeah.
But AI will not think like that.
Mm.
AI will think of common, uncommon, very common, very rare, extremely rare, everything, because it does not differentiate.
Yeah.
What are we taught? We are taught to follow an algorithm.
Okay.
So you come with fever. Fever, so the chart is there.
Yeah.
Fever with vomiting, loose motion, stomach pain, most likely typhoid. Fever, throat pain, throat congestion, irritation, redness in the throat, some cough,
Yeah.
pharyngitis.
Okay.
Fever with body pains, rash, bleeding when you brush in urine, mostly platelets low, so probably dengue.
Okay.
Fever when you are passing urine, burning sense, urinary infection. Fever with severe cough, sputum, tuberculosis, pneumonia.
Right.
Right. I might forget this.
Yeah.
What
As a
am I
human.
doing? I'm following algorithm. After 1, 2, 2, 3, 3. Oh, 3, then I go to the next. I might forget. Some doctors might not forget. What I remember, they might forget. What they forget, I might remember. This won't exist in AI.
Yeah.
AI will know everything about everybody, of every data.
Right.
So AI is not going to be in a there is nothing that AI can forget.
Right.
Right now, the data that is being fed into the AI system is what we have to be careful about.
Got it.
We cannot feed wrong data saying this is the problem. You can't show an X-ray of the skull and tell AI it's X-ray of the leg. Right? Because what you tell it initially is what the data picks up.
Right.
So that way you have to be smart. See, you have to feed textbook information. You have to give it proven information.
Right.
What you are being fed has to be vetted by, for example, there's an MRI. If 9 people are thinking that it is XYZ problem, 9 people's data should be XYZ problem. If all 9 are giving 111 diagnosis, then AI is confused.
Yeah.
So this is where errors cannot be done. For example, you take Google Map.
Sure.
There are errors in Google Map also.
It happens, yes.
Right, it happens. Will you allow that error to happen in healthcare, in AI?
Very risky.
Very risky. That is where everything needs to be stereotyped, make sure it is protected. The information data you're giving should be not average, should be the best quality. Right? And when that kind of information comes, then only AI's highest quality will be available. Is what is available today enough? Yes, I think so.
Okay.
But to identify and perfect it, it will take time. For example, that Tesla taxi has been being available for the last 8-9 years.
Right.
Today they are in a position so that without a steering wheel, because they are confident that it can go.
Yeah.
That confidence will be much more required in healthcare.
Get that.
See, like we said last time, what I see in the next 3 to 5 years is very simple. Today, you come to a hospital, go to the registration. I want to consult with Dr. Chaitanya. Sir, go. It is your now is 9. Your appointment is 9:40. Whatever. Have a cup of coffee and go. You go to Chaitanya's room. Nurse outside will check your pulse, BP, oxygen level.
Right.
We can't check anything more. Maybe temperature. You will come to me, I'll ask you some questions. Based on your questions, you will give me some answers. Based on that, I will think that this is probably what you have, or that is probably what you have. Both of this with background diabetes, blah, blah, blah.
Right.
Is what I am going to think.
Right.
I will put one instrument that I have, torchlight to see your eyes, your nose, your throat, one stethoscope to put. All this will take how long? From the time you come at 9:15, 9:40, 10 o'clock. We are talking 45 minutes. Right?
Yeah.
Now, after that, again, my assessment of you might be the same as 9 other people, but there might be one person who will feel differently.
Yeah.
I might want to give you no medicine. There might be somebody who will want tests immediately. Based on that, I will decide. There will be somebody who will say, no, get these tests done and see. So that's all varied. It's all, medicine is subjective. What I think you have.
Right. Yeah.
In the future, in 3 to 5 years, it will be AI based enabled is what I feel.
Okay.
The cameras are on, 360 degrees cameras are on in the hospital. All goes into a neural network, which is AI.
Yeah.
The minute you walk in through the door, AI is knowing how many times you're breathing, the way you're walking. It knows your breathing pattern.
Yeah.
Whether you are bending this way, that way, it knows.
Right.
And imagine there's so much data on just breathing in the world, so much data on respiratory patterns in the world, so much data on limping, so much.
Yeah.
So it has already knows all that by the time you come and sit in front of the AI chatbot.
Right.
While you are sitting down, it will know your temperature. Cuff BP is what you're putting and pressing. You can put your cuff and press, it knows your pulse, BP, ECG. Today, instead of putting 12 ECGs, you get a device.
Okay.
You just put and press, ECG comes normally.
Right.
So now that one mesh robot will probably put a machine, your ECGs come within quarter second.
Got it.
That same thing will have, now airports, they are doing X-rays.
Yeah.
You know that, right?
Yes.
So X-ray is done. So it knows your pulse. It knows your BP, it knows your temperature, it knows if you're sweating or not, it knows the way you're walking, whether you're anxious, not anxious, what is your gait, everything it knows. It knows your X-ray, it knows your ECG, your temperature. While taking the X-ray ECG itself, that probe will probably be within that ECG, your echo is done. What is an echo? I am taking a probe, putting it and checking to see different views.
Right.
That will pick it up in 1 second.
Correct. Yeah.
So today echo takes 10 minutes because I have to put you, position you, change you. Am I seeing correctly? Is the probe gone this way, that way, everything, color flow. Subjective time.
Right.
The person who's doing it takes time.
Yeah.
A very good technician, cardiologist might be finishing it in 2-3 minutes. But Chaitanya, if he has to do, I might take 10 minutes. You think AI will take 10 minutes or 1 minute or less than 1? It will probably take 1 second. To do an echo. Yeah. Same probe will go to your abdomen, ultrasound.
Right.
It has already picked up fever, I am having this, that. It has probably identified everything. There's fluid in the lung, your ECG is okay. Then it will ask you, these according to me, this is what I feel is the problem. Like could be that rarest of the rare, or could be common of common tuberculosis, viral infections, dengue fever, malaria, whatever.
Got it.
Do you want to, we would suggest these tests for you and this 1 or 2 medicines. Would you like to go to the lab on first floor, or do you want to consult our physician, Dr. Chaitanya?
Yeah.
What will you say?
I'd
If
want
you
to
ask
consult.
me, I will say I will go to the lab.
I would still say I'll go to Dr. Chaitanya.
So that is because, so our opinions are different, because what I feel will happen in AI,
Right.
which is happening, is going to be very good.
Okay.
What is Chaitanya's knowledge? What I have remembered, or what I have read, what I continue to read, or what I continue to remember, or what I'm reading every day.
Right.
Do you think Chaitanya will remember better, or AI will remember better?
AI will obviously remember.
So why do you want to meet Chaitanya?
That's a question to think.
So why do you want to meet a consultant?
Now at this stage,
again, it boils down to who you think. See, we are all social beings.
Right.
Remove that social being. See, there are a lot of people saying, no, medicine will not be replaced. There are doctors who say it will not be replaced. There are doctors who say it will be replaced. Then there's common man who has 100,000, 101
Opinion,
questions, yes or no. Let's not talk about individual.
Right.
What I've learned is an algorithm.
Right.
Medicine is an algorithm. It is no great science.
Yeah.
If you can remember that algorithm to the T, you are the best doctor.
Got it.
But nobody can remember that. The textbooks are infinite.
Right.
Cardiologists will not know neurology. Neurologists will not know cardiology. Both of them won't know nephrology. General medicine will know some of everything, not everything. Gynecologist will not know about anything but gynecology. Pediatrician is involved in pediatric care, not in adult care. AI is not that. AI is everybody.
Right. So, sir.
So the information AI has is far superior to Chaitanya, far superior to the gold medalist from AIMS, or gold medalist from AFMC, or JIPMER, or Nizams, or Ramachandra, or Apollo. Nobody is a match, in my opinion, to the algorithm that they're learning, as opposed to AI that is being fed the data.
Now, here at this stage, I want to ask this question, right? If AI becomes so powerful, where you say doctors can't remember as much as AI can, before this, I want to take a step back. You spoke about the risks, right? A 35-year-old man in Gurgaon, he died because of a robot mistake, right? If you know this, it is I don't want to take the hospital name, big multi-specialty brand, so I'm scared of taking their name. So he died because of a mistake done by a robot. Now, what do you speak about that?
See, today it is robotic surgery is an equipment the surgeon has to use to operate.
Acha.
Robot is not operating by itself.
Meaning,
for example, I want to cut 1/4 millimeter. As a surgeon, my hand might not be able to cut 1/4. I might cut less than 1/4. Mostly, I will cut more than 1/4 millimeter.
Okay.
But AI, if you put in that robot, cut 1/4, it will cut 1/4.
Right. Okay.
It is very likely that machine, that is not AI.
Okay.
It's like you press enter, you go into the next line.
Acha.
So it is like that. You are typing.
So I'm feeding the data of how much it should cut.
That's all.
It does exactly what I say.
That's all. It has no brains.
Okay.
There is no intelligence.
It's not AI then.
It is not AI.
Acha. Okay.
It is not AI.
Right.
What this robotic surgery is an equipment so that in fine cutting, fine surgery, 1/4 means 1/4.
Get that.
That is what robotic surgery is assisting. It has no brain, it has no intelligence, it is not AI.
In this case, whose mistake it is?
It could be a failure of that robot. It could be failure of the data which they have entered into it, or both, or multiple things.
Got it.
But this is robotic surgery today, like robotic knee replacement, robotic that replacement, robotic this is all. Robot is assisting the surgeon. Means surgeon is sitting, feeding in the data. So he could be sitting in front of the machine, next room, next city, next country, doesn't matter. He is feeding a data. Based on that data, it is cutting.
Achha.
It has no brain. So what we are talking about is AI. AI and this robotic surgery are not linked. Will AI assisted robotic surgery come? Yes. But do we know it exists today? No.
Achha, so here it is a tool basically which is doctor kind of fusing and feeding
Correct.
it what to do.
Correct. Like Da Vinci
Okay.
machinery, so many things that are there today
Right.
are all not AI robotic surgeries.
Got
It is a robot which is assisting the surgeon in precision. For example, you are cutting next to a tumor, cutting next to the heart, cutting next to the blood vessel. You want to cut quarter millimeter. Robot will cut quarter millimeter. If I were to operate, I might first tension, stress. That robot won't have. It is not AI. It is not thinking and to cut. It is not following an al. It is you tell 1 millimeter, it will cut 1 millimeter. Go cut here, it will go cut there. Go cut there, it will go cut there. Go cut that bone here, it will cut that bone here. Put this there, it will put there.
Okay.
That's all it is doing.
Got it. It's like a tool at this stage.
Correct. Like in Iron Man, Jarvis the robot, it does what Iron Man tells him, right? That's what it is doing. It has no brain.
Right.
So AI will definitely come. I'm sure they're working on it.
Right. Yeah.
So what other thing like that eye retinal scan? Now they don't have to come to the city, no? They'll do it there. AI will tell you grade 1 or grade 2 do ECG. You probably have cardiac issue.
Yeah. With this one question, right? You in between. You also spoke about people in village, AI being there. They don't have to come to city, etc. Right? Does this mean the affordability of the treatment goes down if the AI is fully implemented?
Yes. See, to do a health checkup,
Right.
you need tests.
Okay.
Whatever tests are done, that microbiologist, pathologist, lab in charge has to double check, sign it.
Yeah.
That you bring to a doctor.
Yeah. Correct.
I see with my knowledge, though it is vast, it is limited compared to what AI's knowledge is. I will guarantee you that. Knowledge of an individual doctor will be no match for the level of knowledge AI will have.
Got
AI will your computer forget the data you put into it?
No.
It's not forgetting for the last 30 years.
Right.
It will not forget till you die, until your grandchildren also are gone. It will remember. You put it into hard disk. How long does it take for you to retrieve that information you put on your laptop 30 years ago? Press of one button.
Yeah.
You think that is faster or you are faster?
That is faster, obviously.
So what makes you think AI will not be superior to individual doctor?
Get that.
AI will be far better than individual doctor.
Right.
Now, there you feed an ECG. There are many physicians who want an expert opinion from a cardiologist about the ECG. So you get a health checkup, you come to a physician, I might give you this, but I ask for a cardiology opinion.
Got it.
You have to go to the cardiologist.
Right.
Cardiologist will see based on that ECG, the echo, he will give you his opinion.
Understood.
All this is removed, no?
Yeah.
You feed the data into the system. It's like full average of every doctor possible in the world and all the data you have put into it. My knowledge is with my experience.
Right.
No? My experience is limited compared to 10 doctors'
Correct.
opinion. Those 10 doctors' opinion is limited compared to 1,000 doctors' opinion. Those 1,000 doctors' opinion is much lesser than all the doctors of Hyderabad.
Yeah.
But AI is all opinions of the world combined.
But do you think
That is applicable to every ECG that you are feeding into it.
But again, I want to bring this bias into the picture. Do you think there can be a bias of AI in the decision making?
Yes, that is what I am saying. The data that you are feeding into it for it to learn is important. For example, if I give you wrong information,
Yeah.
will you learn the right thing?
No.
Like a child, you put the kid in a good school,
Yeah.
he will learn good.
Right.
Put him in bad company,
Yeah.
will he be good?
No.
Can you expect that kid to be better tomorrow? Unlikely. So information you feed into the neural network is very important.
Right.
That is what I think they're doing for the last 10 years, and they're making sure that it is being taught is accurate and correct.
Got it.
Because a mistake can kill somebody.
Yeah.
That is not.
No. So at this juncture, I'll ask the question that I wanted to ask, right? So 10 years from now, what do you think will be the situation of doctors? Because if AI is becoming so powerful, and if I go back, we'll discuss on the comments probably in the later segment. But what do you think will be the situation of doctors?
See, and I'll tell you what I feel is going to happen in AI in the next 2-3 years, and
Sure.
then what will happen to doctors. And I think physicians like me, our roles will be lost in 3 to 5 years.
Because a reason
So 10
behind
years,
one of the
10 years, Pradeep, is too far. I am telling you, in 3 years, I will not have a job. I will not have a job in 3 to 5 years.
Right.
So today, where AI is being used majorly is, see, India hospitals are individual run, corporate run.
Right.
Look at centers like US or Europe, mostly government run institutes, where the doctors are overpressed like in India, overworked, hospitals are finite,
Right.
equipment utilization is maximal, beds are overflowing,
Okay.
appointments in UK will be 3 months from today.
Oh my God.
You will not get appointments at all.
Okay.
So now when there is a patient who requires, for example, like 108-911 call,
Right.
they are picked up today.
Yeah.
In the ambulance itself, look at what can happen. The doctor or the nurse in the ambulance, 99% the nurse, will feed in the data, the pulse, the BP, the oxygen, the saturation, the temperature system.
Yeah.
Because right now there is no robot to check.
Yeah.
There is no AI in an ambulance. Right now we don't have it.
Right.
So they feed it. They do the ECG, the X-ray. That is fed into the neural network. It is telling you it is a heart attack. It is telling you there is no heart attack. ECG is normal, echo is normal, X-ray is normal, BP is normal. Nothing is happening. IVC IVC collapsibility or not is identified.
Right.
This is heart attack. This is not heart attack.
Okay.
So if you know, you can triage whether this patient requires urgent care or not.
Yeah.
If you don't know, both are urgent.
True.
So you go to an emergency and you fill the bed up with a person who's having gastritis. The fellow who's coming in the next ambulance has no bed. He is waiting.
Correct.
AI will be able to tell you, no, this fellow can go second, but this fellow has to go first.
Correct.
Do you want that to happen or not?
That has to happen.
So triaging the patient in an ambulance is done.
Oh.
Now, if you know that this fellow has heart attack, will you take him to a heart center or a gynecology center?
Heart center, obviously.
Right? So the in IT neural network will tell, please take him to hospital XYZ where cardiologist is available, cardiac specialty is available right now. Don't take him to a small center where they'll again evaluate and you'll lose time, because golden hour is there.
True.
These 2 points are done. In there, once you reach the emergency, triage is done. They already have the information. The AI is telling you patient XYZ is coming with a heart attack is flashing.
Yeah.
All this physically I have to see, but it is knowing no.
Correct.
It will automatically self-order cardiologist's opinion. Self-block the cath lab.
Right.
In India, it is different. Everything has to be paid for separately or insurance or some government scheme.
Right.
In international countries, everything is government thing. So they get the best of everything. There are delays. Indian system is far ahead.
Right.
Because of privatization.
Understood.
But there is Europe, there is no privatization in UK.
Yeah.
So you have to go through their NIH system, whatever.
Right.
So there, all this makes a difference. So the tests are ordered.
Right.
Now, I might give a medicine as a physician.
Right.
The cardiologist will come and add something. There might be an interaction.
Right.
AI will not allow interaction of medication. It will block it.
Right.
Many a times we miss.
Right.
We don't look at it. That AI will identify.
Got it.
Then the dose for you at your weight and the dose for me at my weight are different. AI will calculate within seconds. Drug interactions will be identified.
Right.
Your tests will be interpreted within seconds. So these are where many small things which we don't look at. I'm sure you thought of AI, read about it before coming, but you might not have thought about what the ambulance AI can do, how the triaging can be done, how the prescription can be checked and vetted, how dose calculations can be done. These are basics.
Got it.
Then you do an X-ray, CT, MRI, EC, echo, ultrasound.
Right.
One radiologist mind you want or 10,000 radiologists mind you want?
10,000 mind.
AI is far superior to even 10,000.
Yeah. The kind of data
If
it
AI
has.
is able to give you data, why would you want to meet a doctor? Today it is like, Arey manam doctor, we know, manak telusinodu, Chaitanya is my friend, go to Chaitanya.
Yeah.
But if AI knows what millions of Chaitanyas know, why do you want to meet Chaitanya? What is Chaitanya's role?
Yeah.
And if Chaitanya thinks that he's better than AI, something wrong with Chaitanya.
Absolutely. I agree. Hands down.
Means I'm a megalomaniac. See, in other words, what professions can be lost? Emergency physicians will not be lost.
Right.
Right now, robot can't do emergency services. Will it come? It will come. But how long will it take? Long.
Okay.
But what will come immediately is, apart from all these that we just explained,
Yeah.
reading a X-ray, CT, MRI, ECG, ultrasound,
Anything
Doppler,
which is report.
which is see, means what? What is a CT? Radiologist is reading a CT film.
Yeah.
One brain or 10,000 brains?
10,000 brains.
The answer
No
is
brainer.
done.
Yeah.
No brainer.
Ah.
Dermatologist is doing what? Looking at your skin.
Correct.
One dermatologist or 10,000 dermatologists?
10,000. No brainer again.
Pathologist looking at biopsy specimens. One pathologist or 10,000 pathologists?
No brainer.
10,000. AI. These, according to me, will be taken over. Next step
Right.
will be my job.
Physician.
Algorithm. I might forget an algorithm, but AI cannot forget an algorithm.
Okay.
So we might miss rarest of rare by thinking,
the case that
start
we
the
discussed.
antibiotic, let us see. Because tests are expensive.
Yeah.
But AI will have even that data with it.
Makes sense.
Surgeries, not yet. Emergencies, not yet. Nursing staff, not yet.
Okay.
Third class employees, IMRs, not yet. But physicians, dermatologists, radiologists, pathologists who are reading, anybody who's able to identify an organism under a microscope, again, one eye or 10 million eyes.
AI, 10 million.
Logic is very simple.
You have answered so many questions that I already had here. I was just cross-checking. Okay, this is over.
So AI is there. It is going to take over medicine. People like me will be out of a job in 3 to 5 years.
Okay.
If a car can drive itself, why can't AI read an algorithm? In medicine, it is left or right only. Algorithm means you have left column, right column. Left low, you go one below the other. Right low, you go one below the other. There is a crisscross.
Right.
I will forget it, yaar. I'm telling you, I might not remember everything. AI cannot, forgetting does not exist in AI. Like your computer. What you put into it, even 100 years later, you can retrieve.
Understood. So, with this, what I understand, surgeries AI cannot do.
Right now, robot is a tool for the surgeon for precision cutting.
Okay.
It is not AI.
Okay. So,
AI, once there is enough data, I'm sure they will put AI into surgical things to do.
Like driverless car in Tesla, which took about 8-10 years.
8-9 years.
From here, another 8-10 years, we will be there where...
And to perfect many things, it's only a learning curve. No, see, the learning curve of these are steep. They're steep. So, an accident is acceptable, boss. You might have a closed circuit, your own private land where you're driving 100,000 robo-taxis, one accident here or there doesn't bother.
Right.
But one life matters.
Yeah. So, surgeries, we are not there yet, and
It is
not...
At least from what I know, today being almost end of July of 2025, surgeries, robot assists are there.
Right.
Robotic surgery means doctor is putting the data in for it to cut. You can't say do hysterectomy. No.
Yeah.
Do knee replacement. No.
Right.
Doctor has to feed how much he wants to cut. That how much it will cut.
Got it. Friends, if any of you are planning to automate your businesses using AI, at PowerUrBiz, we are offering AI automation services. Do contact on the number that is given in the description if you are planning to automate your business, whether you are from Hyderabad or you're from Chennai, Bangalore, Delhi, Mumbai, doesn't matter. As long as you want a AI automation service, do reach out to us on the given email ID and the phone number in the description. Before this podcast, I did one other podcast in which the guest spoke about how AI can predict accuracy of a pregnant lady on when she will give the birth. And he also built a report for one of the hospitals which basically allocates priority wise doctors. Let's say you spoke about ambulance, heart attack versus a regular accident kind of a thing, right? Here he went into analysis of having data of all the patients and which patient will need surgery at what time, etc. Right? So this tool that he built goes to a level of telling which date and which time a pregnant lady would deliver. Now, today in the market, a doctor says, okay, probably this date delivery can happen. Now, do you think AI is at that precision level? It felt unbelievable to me that AI pregnancy delivery with precision of timing. Date I understand. Timing was a question to me. What do you think of this?
See, definitely, I am not an obstetrician gynecologist, so I won't know as much about obstetrics and gynecology as a gynecologist.
Sure.
But from what little I know, date of delivery is 9 months plus or minus 5 days. If I am not sure, I'm sure you can read it up and put it up here for people to know. Now, where AI will definitely help in prediction is, for example, your ECG.
Right.
Now, let's talk about today's scenario.
Okay.
You are in hospital A, B, C, D, whichever hospital you are in, whichever part of the country.
Right.
Patient says, I'm having some discomfort.
Right.
It could be simple acidity to full-fledged heart attack.
Yeah.
How will I identify that? By tests. Mostly what test will we do? Immediately we'll do an ECG.
Okay.
Once that ECG is done,
right,
the nurse or the physician assistant or both, including the floor duty doctor, who has to come order the test first.
Right.
10-15 minutes.
Yeah.
ECG machine will not be ready on your bedside now. Machine has to come, ECG will be taken.
Right.
Then that floor duty doctor, MBBS duty doctor, if he is knowledgeable enough, he can identify some things.
Right.
But not to the quality of a cardiologist. So he has to now pick up the phone. Sir, this patient has chest pain. I did the ECG. I'm sending you on WhatsApp. Can you see?
Right.
That cardiologist might be busy seeing another patient, might not answer the phone.
Right.
Might be in a procedure in the cath lab, must be doing echo, must be doing TMT or some other thing. He's occupied seeing a patient in the emergency.
Right.
When he has the chance, he will call back or see the ECG and tell, you're losing some time.
Yeah.
AI will tell immediately.
Correct.
Chest pain. Protocol will be patient complaining, immediate ECG. ECG will be fed into the system. AI itself will tell this is normal or this is MI.
Yeah.
It will immediately give an alert to the cardiologist in the hospital, in the station, that this patient is having ST change, heart attack. That information is there on the floor. That information is there in the ICU. That information is now available in the emergency. It is available in the cath lab. Telling people, get everything ready. Like fire rang, you call that fire service, fire ambulance comes. That thing is already done by AI.
Oh. So this is already in use, you mean?
It will be fully functional. Right now it is manual. I have to feed the ECG or send to the cardiologist. Cardiologist will see when he has the time. These are the technical issues we are having.
Got you.
AI, all this is over now. Do an ECG, AI will tell you it is heart attack or not, ST change or not.
Right.
Immediately it will tell you, because this change is there, do this test. Cardiologist is coming or shift to cath lab. Now cardiology team is available, ICU team is aware, cardiologist is aware, floor is aware, administration team is also hospital, because every hospital runs only to save your life.
Yeah.
Everyone is aware.
Right.
Do you want that or not?
Got it.
I would want that. If I am the patient having chest pain, I want my report done now, diagnosis done now, and procedure done now. I don't want to wait half an hour for cardiologist to come. Who's
Very,
going
very
to tell?
true.
Who's going to tell me the same thing? No.
Yeah.
What I'm getting in 1 second, it might take half an hour.
Hmm.
Cardiologist cannot leave a procedure he's doing to come running to you because you have chest pain.
Got it.
There might be one cardiologist only, no, in many centers.
Right, right.
Now, do you want that to happen, or do you want a system like AI to tell you you have an heart attack? Cardiologist is now aware.
Yeah.
ICU is aware. Administration is aware. Cath lab is aware that this is the problem that we have to do. And immediately, within microseconds, there's an alert.
Right, right. So speaking about prediction, one other case, right? MIT in US came out with a prediction model where a lady was identified with she's gonna get breast cancer 5 years ahead. Now, how is this model working? What do you think was working in the back, right? And how did this AI was able to detect that this lady is gonna have breast cancer 5 years from now?
So that was what I know about what you're asking me.
Yeah.
So I think in the US, for identification of breast cancer comes final is by biopsy.
Okay.
But before the stage comes to a biopsy, it has to start from normal,
Okay.
becomes little abnormal, little more abnormal, more abnormal, more abnormal, abnormal, tumor.
Okay.
Then it starts spreading.
Got it.
But this normal is normal.
Understood.
But that small change which has occurred, is it cancer? No. It will change a little bit more. But is it cancer? No.
So AI is
It will
basically
change
reading
more.
a pattern.
It will change more. Again, it is not normal, but it is also not cancer. It is in between.
In between. Okay.
So, for medically, it is not a cancer. Right. So,
right.
I'll have to continue checking you 6 months.
Understood.
And then it becomes cancer. That is when I can tell you. Do you want me to tell you this tumor is a cancer now when it is not a cancer? You don't want me to.
Yeah.
But we always tell you that this has a chance of becoming.
Got it.
So over the years, with multiple AI models and multiple learnings, it can predict that this change is becoming a cancer.
Understood. Understood. Yeah.
But it did not say it is cancer.
It says 5 years from now, this lady will get the cancer.
That even doctors are doing. But the precision with which it can tell you is far superior than one person telling you.
Understood.
That is the future.
Right.
And AI will come into everything.
Right.
Right now, they're driving itself cars. There are humanoid robots that can do cooking.
Right.
You can, in China and the US, now I think there are robots in the next few months to a year.
Right.
You will be able to buy a robot that cleans the house by itself.
China already has it.
In my house, I have a robot that actually cleans by Xiaomi company. It cleans the floor and mops the floor.
Acha. Okay.
There are smaller devices which actually clean, mop, do vacuum and remove the discarded water and fill new water by itself.
Oh.
So what is big thing in cleaning a house? Nothing. Information to treat you is already available. Information to drive a car is already available.
Got it.
Already we have drone technologies where there is no pilot in the plane. They are going bombing in wars. That's what is being used.
Right.
So why can't technology to read an algorithm not be better than an individual doctor?
Right.
I can forget. AI will not forget. You can forget what you have learnt in 5th class, 6th class. Your computer will not forget.
I honestly
AI
forgot.
will not forget. I remember what I learned first, ABCD. But then after ABCD and all, we've learned so many things which you forget. History we forget, geography we forget, math we forget. So many things we forget.
Correct.
So if some information is required by me to think of that, I can't remember, no?
Yeah.
You have to call for an expert opinion.
Hmm.
AI is going to be expert of all the experts together.
Understood. Yeah.
Healthcare, in my opinion, in 3 to 5 years will be redefined highly.
Look at that.
There will be a vast sea change in the way diagnosis is made, the way errors can be prevented, the way emergencies can be treated, way Inpatient in the hospital, emergencies can be treated. Like I was telling you about the
right.
ECG being fed, ICUs, everybody,
Yeah.
cardiologist, cath lab, administration, everybody will be aware of certain things within milliseconds.
Now, with this, as you say, it changes drastically, which means there's an opportunity for a business. Now, I want to understand what are the opportunities other than diagnosis or basic task, right? Report reading, etc. The 4 functions that you said, derma, radiology, etc. What are the other opportunities where you see
anything which is based on an image will be first.
So that
be
we
taken over.
understand is already there, right? And I understand my partner also built a model. It reads papers easily. Anything that comes in the WhatsApp group, it puts it on the Google Sheet. So that I understand. Now, other than this, I want to understand what are the other opportunities for a startup. Let's say anybody wanting out there starting or planning to start something. What are the opportunities that you see in healthcare they can work on and build for India?
My first thing would be, more than major things, I think if you are able to assimilate a system which puts all the data together, and if you are able to give in AI-led diagnosis to people in villages, towns,
Yeah.
the quality of health of the common man in those towns and villages will be well taken care of in the form that first tests are not available.
Example.
Why are tests not available in these small towns, villages? Because which doctor will come? Why now you don't need a doctor, no?
Right.
All you need is one person to feed the data. AI will give you all the diagnosis. This AI diagnosis has to be confirmed by a doctor initially.
Right.
Right. Eventually, I feel the requirement of a doctor as a physician point of view will not be required at all.
Interesting.
Surgeries and all will happen, will continue to happen till we have more information on what the robotic AI surgeons, which is not available right now, what will happen. I'm sure research is being done on it in different ways. See, diagnostic tests, everybody is doing. You AI enable it, it will give you.
Right.
Based on your thing, multiple genetic studies, so many things, it can tell you this medicine will work for you, this will not work for you, this is your risk of cancer, this is your sister's risk of cancer, this is your problem your father had, likely that you will also have. So many things will be available for you at the press of a button.
Okay.
Surgeries, not yet.
Right.
Emergency services, not yet.
Right.
But whatever is image based, X-rays, CTs, MRIs, biopsies, pathology, microscope identification, all those, dermatology, what you're looking at the skin, all those things will be the first, in my opinion, which AI will have a major role in.
Got it.
Second will be algorithm based, like physicians. What am I asking you? Series of questions.
Yeah.
Same thing AI will ask.
I have headache, I have fever, I have XYZ other problem.
And this is your probable diagnosis.
I give it to the GPT or whatever AI and it tells me.
And that it's already available. But that will be incorporated into hospitals, in my opinion, very, very soon. You'll walk in, it will know everything.
By walking in itself.
By walking in itself, within 3-4 minutes of you sitting down, we will have all your readings, your basics, your pulse, BP, respiration, saturation, temperature, X-ray, ECG, echo, ultrasound within seconds.
Right. That means with this, will the cost of consultation go up or come down?
See, again, if you are building a 500-bed hotel and a 500-bed hospital, what do you think will be more expensive to build? I don't want your answer. 500-bed hospital will be 5 times more expensive than to build a Taj or a Sheraton 500-bed.
Because of the equipment.
What is the most expensive thing that you see in a hotel? Today, hospitals look as good as hotels. Real estate of hospital and hotel is the same. Construction cost is the same. You might put one chandelier worth 10 lakh rupees or 20 lakh rupees in a hotel. 10 of it you will put. X-ray machine costs 20 lakhs. CT machine is 6 crores. MRI machine, if you look at 3 Tesla, is 7 to 8 crores. Cath lab is 4 crores. The cost of one OT bed in a hospital, equipment included, is 1 crore to 1.25 crores per bed. Hospitals have 50 OTs.
Oh my God.
One ICU bed will cost anywhere between 60 to 75 lakhs per bed. Who is the most highest paid person in a hotel? General manager.
General manager or
What do you
CEO?
think will his salary be?
Maybe around 4-5 lakhs.
Let's say 5 lakhs. What do you think the average salary in a hospital of a doctor will be?
5 lakhs.
How many managers are there? How many doctors are there?
I get your answer. I get where you are going.
Right. How much equipment is more? Building is the same. Land is the same.
Yeah.
Cost of equipment is unbelievable in a hospital. Salaries of a hospital will be, in my opinion, like general manager at 5 lakhs, there will be 100 doctors at 5 lakhs.
Yeah. Now,
But unfortunate, people don't understand the costs involved. They want everything cheap. Right? Quality comes at a cost.
yeah.
They're willing to spend 15,000 rupees a night in a hotel.
Right.
But they don't want to understand that it costs you 15,000 rupees per day to treat you.
Get it.
See, people have to understand. So, once AI comes, the requirement of so many doctors comes down.
Right.
I am telling you, I will be out of a job.
Right.
And I might see 20 patients a day. AI can see 2,000 patients in a second.
Yeah.
So, hospital also wants to reduce its cost.
Right.
Corporate hospitals are coming in. They also look at what their expenses are.
Right.
What can be reduced? If AI, quality AI, is able to process information better than 100 Chaitanyas together, why should you have 100 Chaitanyas?
Makes sense. Yeah. Yeah.
Finally, again, that one system is better than 100 of me.
Now, one question that is striking on my head right now. On one side, doctors are not required. I understand the number of salaries go down. Whoever is owning that hospital, he don't have to pay to all the doctors. But he has to invest in equipment. Now, whatever equipment is there, he might have to upgrade slightly. And the variation of the cost might not be very, very high. Right? With that, the per patient cost might come down. Is it the prediction?
Definitely. See, when you're starting a factory, first you buy the land,
Yeah.
take the permissions, build the building.
Right.
But from day one, you're not making money. To start a car factory, it will take 5-6 years for it to put everything together.
Right.
So from day 1 to day 5, you're investing for the 6th year.
Yeah.
From day 1, you're not going to make money.
Right.
Then, so same thing will occur in AI. They're spending all that money for the last 10 years on it.
Got it.
That data is being vetted by doctors, by groups of doctors, by teams, by administration, making sure it is all correct.
Got it.
Then there will be again an overlap between both have to work. Then there will be a time where I will not be required.
Understood.
Because what I will remember will be nothing compared to what AI will remember.
Right.
AI's data is accurate. Will be accurate. It will not have, plus minus, it is plus or minus. It is A or B. It is this or that. It is correct or not. True or false.
Right.
I will have a question mark. Emo anukuntunna. That will not happen.
Got it. Now, I want to ask this question on the electronic health report. This in US, from an adoption standpoint, is very, very high, probably upwards of 90+%. Where are we on the adoption of electronic health report in India?
I'm not sure about how much we are using electronic records, because in where I work, we use electronic outpatient software, electronic inpatient software, but there still requires a lot of integration and seamlessness has to come in.
Got it.
So I think in the near, see, again, I am 43. I myself feel I am not fully tech enabled as certain people.
Sure.
Ask my father, he will hate a computer.
Yeah.
That is because their learning has not been on that.
Right. Right.
But learning of 60-year-old people in other countries has been on computers.
Understood.
See, when we were 10, we didn't know YouTube, Insta. Today, 5-year-old kid can use because they're used to it.
Right, correct.
We were not aware of it.
Yeah. My kid goes to Alexa and speaks with Alexa.
Yeah, so they are used to it.
Yeah.
So the system is always developing, incorporating newer things, being inbuilt. Now there are schools that require you to get a laptop, iPad for your learning.
Correct. Yeah.
That was not us. So these kids will not be tech challenged at all.
Understood. Yeah.
So adoption is only going to increase. Without electronic data, there cannot be AI.
Understood. The reason I asked this question is because me and my partner, we have identified this space and we're kind of working on developing a tech in this space. Let's say I'm a patient, you're a doctor in this scenario example, right? Now I'm speaking to you, you're responding to me, or I'm telling my problems and you're telling me, Pradeep, possibly these can be the issues, right? And you might have to get these tests. Now, we both conversed, right? Now, AI is there in a stage where it can hear you and convert that in a text and store that information, right? So, we're looking at this solution as a probable solution which can help and increase the EHR, usage in India, possibly, right? So if we can have a device which is listening to the conversation that you and I are having and build that as a report and put that in, say, Dr. Chaitanya's patient Pradeep had this issue, this was a conversation, this is what the recommendation of Dr. Chaitanya was. Will this solve problem?
No, see, this is what you are asking is only a device that will collect your verbal inputs of two people, input and put it into a paper format electronically.
Maybe it goes into the ERP directly where my records are already
be more
there.
Than happy. That way you reduce my time.
Absolutely,
of
that's where I'm coming to, because basically we already do this from paper to sheet.
Yeah, paper to sheet, but in other words, it's like it is going to assimilate a conversation like WhatsApp and taking that data and putting it into whatever system. Correct. It will be very useful.
It will be useful. So this is one opportunity that I see in this space at this stage. Yeah, because any which ways India is working towards increasing the electronic health report usage, right? So we see this as an opportunity and we're working on this at this stage.
Yeah, because see, the requirement of me to enter onto the system is minimized. What patient is speaking is fed into the system in real time.
Right.
And then that can be AI enabled.
Right.
And then it can give you multiple diagnoses on a system. And even I'll be more than happy.
We're already piloting this, by the way. One other question that I have from implementation of AI in healthcare. I'm sure maybe you're not the right person, but basis your knowledge, I want you to answer, right? What steps do you think government is taking, if you have a visibility of it? How is AI in healthcare being monitored from a governance standpoint within India? I'm asking.
See, from the government point of view, I don't know what they're doing, but I think government will have a major requirement of AI because for its subjects, which are people in villages, towns, they can get access to quality healthcare.
Okay.
Via AI.
Right.
Which is currently not available. Government is forcing doctors to go 1 year and work.
Understood. Okay.
Like post-graduation, you have to go work 1 year. After super specialty, you have to grow 1 year. That will all not be required. There's a resistance. No doctor wants to go work in a village.
Right.
So all this can be done via AI.
Okay.
So government has a much higher need. A private institute might be for profit, but for government, that is absolutely a requisite.
Right.
And I'm sure what is deploying AI doesn't cost much for a government. It might cost a lot for you and me.
Yeah.
But for a government, it's in small peanut money.
Understood.
And to be able to deliver quality care.
Yeah.
AI-enabled diagnosis, testing with reporting, AI vetted, unbelievable, no? Which you'll have cardiac diagnosis, neuro diagnosis. Trust me, you'll have diagnosis available.
Right.
That data, how much data will be available? How much quality care can be given?
Yeah.
Right?
Yeah.
Now you hear, sir, I had nothing, sir, they did this. All that will disappear, no?
Correct.
AI is not going to say you have a heart attack if ECG is normal.
Right.
AI also will not say it is normal if ECG is showing heart attack.
Yeah.
AI cannot tell that the heart is not functioning and heart is functioning well. So all these things that people talk about will all not exist itself.
Got it.
It will be the truth and nothing but the truth.
Understood.
I'm not saying doctors do it wrongly. Miscommunication, misinterpretation. Some family member will come and say, you didn't tell me anything.
Got it.
Everything will be available for the whole world to see. What is there?
Yeah. Yeah.
Scan, hernia. There, yes or no?
Right.
I'll tell you, you have hernia. Somebody will say, he doesn't have. All this will not exist.
Got it.
You fell, fracture. Sir, I didn't have a fracture.
Right.
X-ray can't be wrong. You have fracture or you don't have fracture.
I think this question was more from a governance standpoint where biases doesn't come in. We spoke on the biases, right? AI has biases, wrongly fed data.
That is because of wrongly fed information which they are correcting.
How is that? What role do you think government will have here to monitor it? Is what
No, I think that's too far from now.
Okay.
I think we'll have to give it some more time to see. Once the system comes into place only, then only is the question of monitoring it. No?
Got it. Got it.
I'm sure with AI, things will not be plus minus, yes, no. It's plus or minus, yes or no, true or false, correct or not.
Right.
It will not have this third thing at all.
Yeah. So I think we're coming close to our end, right? I want to dwell with you on a couple of comments and two more questions for somebody who's watching this, right? So first I'll take up comments and then I'll come to suggestion for someone wanting to pursue doctor, right? So things which I couldn't answer, I want your help. One viewer said Indian doctors never lose license, unlike in US. Is that true?
No, Indian doctors can lose license.
Okay.
So the system, doctors fall into the civil case in the US.
Okay.
In India, it is not easy to put a civil case on a doctor.
Okay.
Generally, it is not. Maybe now their system is changing, but no.
Right.
If a case is put, it has to be put in the location of the hospital. Not in the patient's town. Patient can be from Delhi, but he had a problem in Hyderabad. He was treated in Hyderabad. The case has to be in Hyderabad.
Acha, okay.
For Hyderabad court to take up that case, the medical council has to give its first judgment.
Got it. Okay.
Medical council will call, if the case is in Hyderabad, Telangana Medical Council will call both parties. Litigant is generally the complainant, who is the patient's family.
Right.
And the doctor who the case is on.
Right.
Both will express their points
Yeah.
together in the same room to the medical council.
Okay.
Legal team.
Right.
Their opinion favoring the doctor or favoring the complainant will be recorded and given to the court.
Understood.
If that is favorable to the doctor, that case cannot be taken up in court. Because there is no case. The team of professional doctors are saying doctors are correct.
Understood.
If they find that doctors are wrong, the case will be permitted in court.
Got it.
Then there is High Court, their court, Supreme Court, like that.
So at what?
One thing, Pradeep, no doctor wants to do something wrong.
Yeah.
Right? If I do something wrong to you, will you come back with more patients to me?
No.
నా పొట్ట నేను కొట్టుకున్నట్టే కదా.
Right.
Why will I do anything intentionally wrong?
Right.
Errors occur. AI will not allow error to occur.
I think
AI will not allow error to occur.
Yeah.
See, that's the difference in that fine things. I might think, let's wait 2 more days. I will not think of rarest of rare.
Got it.
AI will think of that also. This is where the difference will come.
Right. Somebody who wrote this question would have asked more from point of view of some doctor does intentionally something.
Like I said, who wants to do intentionally? See, while you're driving a car, you hit somebody. You hit him purposely?
No.
That's why it's called accident. No? And then people get down and fight on the road.
Yeah.
It's called an accident.
Happened
by mistake, not intentional.
Right. Got it.
There will be intentional things that can happen, but in a hospital, why will I want to do something to hurt the patient?
Right. So another said dermatologists will be replaced first since pharma companies will save more money. Do you agree?
Yeah, see, what is a dermatologist or a radiologist or pathologist doing? Reading an image.
Yeah.
One person reading the image or AI reading the image? AI will know reading the image
Yeah, we spoke,
far
I think.
better.
This is covered in this session already. A comment said government jobs require bribes and that's why AI replacing human might be good thing. What's your take?
And a government, see, bribery is there in most professions. In medicine, I think it does not exist.
Okay.
What, I'll take a bribe to treat you better or take a bribe to treat somebody lesser. See, I will not be doing some things which will jeopardize my future, no? If I treat you wrongly, will you come to me?
Right.
Now, what happens in district villages, I don't know. I've never worked in that setting, so I really don't know.
Yeah.
Because people say in medical government college, sir, government hospital, he didn't admit me, he took 1,000 rupees and admitted me.
Correct. Yeah.
All this will disappear with AI, no?
Yeah.
AI will know whether that requires admission or not, whether it is heart attack or not, whether it is worth considering or not. AI will know, no?
Right. And then I think
So if this might answer his question, if he's feeling somebody is not being admitted because they don't have money,
yeah.
even AI will task to admit, but finally who has to pay the bill? They have to pay the bill, no?
Here, I think I remember one case reading online somewhere. Porsche accident in Pune. This guy was an alcohol
Under the influence,
Yeah.
but they gave a report saying not under
obviously the cops involved also tried to say wrong, and the doctor also gave a wrong report. And at a later point in time, it was proved that it was wrong. So maybe things like that.
All those can be avoided, no?
Yeah.
See, because you give the sample, report comes within that whatever time frame.
Right.
Report is given to AI neural network, no? Because if there is alcohol in the sample, I can fabricate that it is not there physically.
Right.
AI, there is no fabrication, no?
Makes sense. Yeah. Another comment. There are more comments. Probably I'll ask this as the last, and then we'll move to the next segment. Some pathologists argue that their histopathology, sorry, and smear can't be replaced, only assisted. Where do you stand on this?
What is histopathology? Histopathology is study of tissue problems.
Okay.
Pathology in cells tissues. Stain it, slide it, microscope. Who do you think will read a slide better? It's an image. One eye or AI? AI.
Yeah.
Pathologists will still be required to do the stain. But once like the retinal scan, the image has to be taken by the ophthalmologist, by the pathologist.
Right.
That image is fed into AI.
Right.
AI will give you diagnosis.
Makes sense. So, last three questions. So there's the startup where Elon Musk is working on Neuralink. So you think in the brain and you don't have to touch, things will move. Somebody does not have a leg, maybe Neuralink will have a artificial leg, and with mind he can walk, something like that, right? But the latest stage of this, I have a chip in my brain, and I think, and it is happening. Is this going to happen?
Neuralink already exists. They are doing phase 3 trials and human trials, phase 3 or phase 4.
Okay.
Where it is showing results. So brain is a very great system. We use only 2 to 3% of our brain.
Oh.
Even Einstein used only 5 to maybe 7%.
Yeah.
95% of the brain and what it does, we still don't know. We still do not know how the brain functions. We only know what we know. Not even 1 to 2% of our brain we know. In so much human life, so much technology, and Neuralink is based on what little we know. Imagine what we don't know and when we will know it, and what all these can do for our future. It is unbelievable.
Oh my God.
We do not know anything about anything in our body's functions through the brain. Till today, we do not know.
Okay. This is
There is a
crazy.
book called Brain Rules.
Brain rules.
Brain Rules.
Okay.
Read that. It's just 250 pages. Anybody interested in understanding brain from a common man point of view,
Yeah.
to understand what little neurologists, neuroscientists, neuroanatomy, neuromedicine, what all the brain is. 5% or less of the brain, what we know till today in our life as of end of July 2025, that book tries to explain in common words.
Okay.
In 1-2 days, you will be able to read it. Very simple.
Makes sense.
It will tell you how vast it is and what all we don't know. So it is the brain is beautiful. And imagine if they are able to stimulate some part, and a person without a leg, he can start moving his artificial leg by
Right.
thinking, is unbelievable.
Right. Right.
Like a blind man can see.
Got it. Got it. So, two questions. Somebody aspiring to become a doctor and somebody who's already in the journey of becoming a doctor. Uh, uh, somebody already in the college right now. This is from their perspective. Now that so many, because there was one comment who was pursuing radiology and she wrote saying, "Oh my God, my dream job of radiology, is it going to vanish? What do I do now?"
Answer is simple. Change your profession. If you're not a doctor, don't become a doctor. Your future will be, there will always be a requirement for a physical presence.
Okay.
For the next 10, 15 years, there will be. But like I said, image-based medicine, radiology and all, will be the first to be affected. Algorithm-based, like diagnosing skill, will be second to be affected.
Okay.
Surgeries, emergencies, traumas. Right now, we don't know what is happening, and AI, can it take over surgery? In my opinion, no.
Got it. Got it.
You will require skill. Image-based also, certain things will be required for vetting.
Okay.
But then your future medicine career, for somebody who's joining medicine or who's in medicine, you have to think of next 50 years.
Yeah.
In 5 years, I think I will be out of a job. So think smartly, think better.
So, somebody who's in their final year or just passed out and just entered into the practice, right? Should they learn coding or get their hands on AI?
Definitely the person who will be an advantage in medical profession will be somebody who understands AI.
Okay.
Now whether coding is required or not, whether studying something else is required or not, for you to be better than the next person is going to define your future. So if you have to be somebody who's AI tech aware, enabled,
Yeah.
then you will have a better understanding and you will have a better scope in the future.
Got it. Got it. Let's say somebody out there is in still school or 12th or something like that. They are sure they want to be a doctor for sure. There's no other option that they think of. What fields within the medicine should they choose so that they are in this profession for long?
I have never asked anybody to do medicine in the last 10 years.
You said this in the last episode also.
I feel in India, medicine is a thankless job. People want to come the last minute, want to be seen immediately and treated yesterday and discharged right now. Life does not work like that. Maybe AI will change all that. What will be the first thing that will be lost is image-based medicine.
You said this, yeah.
Your X-rays, CTs, MRIs, your ultrasounds, Dopplers, your CT scans, then dermatology because it's image-based, slides and specimens, microscope, pathology, these. Next will be algorithm-based.
Right.
Diagnosing skill, like general medicine, I'm following A to B to C, that.
Yeah.
Next, surgeries will take a long time or not, we don't have data yet.
Okay.
So if you want to be doing medicine, and I recommend against doing medicine, try to do some surgical work, cardiac procedures work,
Right.
surgical work, neurosurgical work, urological work, where procedure driven is required.
Got it.
That skill, though robotic surgery is there, it is not AI robot. Robot is a device today that assists. That assisting will become far and far and far and far superior.
Yeah.
Which will still, in my opinion, require a surgeon to operate.
Got it. So we have the answer with us. So doctor, thanks for giving time again. This has been definitely one of the good episodes, I believe. I'm sure viewers who have seen this or who are seeing this till the end would definitely get great learnings. And if in case you are wanting to approach doctor, you can search for Dr. Chaitanya Challa and he's available in Care Hospital. Yeah, thanks,
you.
doctor. Thanks for coming on the show. Thanks for watching this episode till the end. If you find the video useful, please hit the like button, share your feedbacks in the comment, and don't miss to subscribe. Do share this video with your friends and family. Thank you.